State University is focusing on urban public health. I'm Jill Horner. This is Comcast Newsmakers. With me is the Dean of the Rutgers School of Public Health, Dr. Perry Halkitis. Thanks for being with us.
Thank you for having me.
There has been a School of Public Health at Rutgers, but there is a new focus and a renewed focus on urban public health. Define for us what you mean by urban public health.
Well, so the Rutgers School of Public Health has a tradition of 35 years, so there's decades worth of public health work. Urban Public Health is our new program. It is a program that is based primarily in Newark that focuses on issues of social justice, how discrimination, bigotry, social inequities lead to health disparities, and how we train a next generation of scholars and practitioners to have the tools, both the scientific tools, but also the advocacy tools to work with populations that are affected by heightened health problems. And that's our new focus. Our focus is on advocacy and scholarship coming together.
And this is really a twofold approach is what you're talking about. You're talking about the research component because you are training scholars, but you're also training these scholars to be advocates as well.
Absolutely. So public health work, I believe, at its core is a activist discipline. It is an advocacy-based discipline. I started my public health work as a member of ACT UP. I think our students are demanding the skills that put them into the world to learn how to improve the health of the populations that they're working with, provide them an opportunity to express their voices, to fight issues of discrimination around gender and race and sexual orientation, all of which lead to these health inequities that we see around the world, but really concentrated in urban centers.
This is a master's level program, but there are opportunities for undergraduates as well.
Absolutely. This is a master's level program. This is an MPH that one can finish in 2 years' time if one goes full time, but it also is a degree that somebody can connect to their bachelor's degree. So for 5 years, you can get a BA or a BS tied to this MPH in urban public health.
Why would you encourage people, even if they're not in this program, to think about urban public health and why it has an impact?
So we know that the majority of the world's population is going to be living in urban centers and is living in urban centers. Problems are going to get even more concentrated. Fading infrastructure, people living right one on top of the other, of different cultures, of different nationalities, of different genders. And so health issues get exacerbated. So as this grows, we need a set of practitioners, we need a set of scholars, we need a set of advocates that can go into the population and think about the well-being of a city. Right? It's not enough just to focus on individual health. We have to think about whole groups of people and how we improve the health of whole groups of people, and as a result, the health of the entire city.
And if people are interested in this program specifically, they can reach out through your website, and the program starts this fall.
Absolutely. It starts this fall. We're accepting applications now. Anybody who wants to be a 21st century MPH student should look at this program.
Thanks for being with us.
Thank you.
We've been talking with Dr. Perry Halkitis. He is the Dean of the Rutgers School of Public Health. I'm Jill Horner.